Welcome to CMMS Radio, a podcast and general resource for all things CMMS, computerized maintenance management software, from selection to implementation to help you make better choices and have a successful CMMS journey. We'll bring in experts along the way to help us learn more about CMMS, facilities operations, and much more. If you need help with the CMMS project, send a message at cmmsradio.com using the What's on Your Mind link. Suggest a topic, share your CMMS story, or ask questions. Thanks for tuning in, everyone. We are getting into a long overdue episode. I've wanted to do this since early this year. We're finally doing it today. And it's not, what we're going to talk about as a CMMS, it's not just any CMMS that we're learning about today. Our guest today is Joe Serwinski. He is the president and founder of FSI, a cloud-based computerized maintenance management software, or CMMS, purpose-built for healthcare system professionals. And I love that. They empower maintenance and healthcare technology management teams with unified, intelligent tools needed to stay ahead of disruptions and optimize resources. And they led the development of on-site data collection and standardization of best practices that have been adopted by leading healthcare systems and professional bodies, such as the American Society for Healthcare Engineering, ASHE. You can learn about FSI software and their 6 core product offerings and service offerings at fsiservices.com. Joe, welcome to CMMS Radio.
Thank you, Greg.
It's really great to have you here. And like I said before, I've been wanting to do this episode for quite a while. And one of the reasons behind that is I love that your solution is focused on healthcare systems. It's got that purpose-built element to it that I personally think is important when people have to differentiate between products. And I'm not as interested in products as I am in the services behind them and the processes that they enable for these people to just do the great work they're already doing. And you bring that to the next level. So this started in 2002, and I would like to understand your background and the journey that led up to the formation of FSI.
Okay. It's interesting. It goes back 35 years. So 35 years ago, I started at Children's Hospital, Pittsburgh, as a CAD draftsman. They got a new CAD system and wanted to put all the floor plans in the 80s. So I started with that, and they had a work order system in place. It was a paper system, and it was the old index cards. I don't know if you remember the old index files. When the index card came to the front, it was time to do that PM. So I computerized that back in '88. I computerized the index card system into a DOS system. So worked there, in new hospitals. I was in charge of all the documentation for any regulatory inspections for the hospital at that time. From there, there was another software vendor that had a CMMS that was looking to go into the healthcare space. So I jumped over and I went into the healthcare space, or went into the software space and created a healthcare CMMS. And it was out there, and I was the product manager of that. I was the salesperson. I implemented the system there for years, and then we went through Y2K. So with Y2K, it was easy selling software. So I was selling hard and heavy in 98, 99. And in the early 2000s, I was realizing these companies were switching. They went from the DOS platform to the Windows platform to the internet. So in the 2000s, it was harder to sell software because everybody just recently bought Y2K compliant software. And so I realized it really wasn't the software, it was the data. That's why people were switching. Once everything got to the Windows platforms in the early 2000s, it was the data. If you had good data, you could make any system work, kind of thing. So that's my background. So in 2002, I said, you know what, I'm going to start a company called Facility Survey. And what we're going to do is we're going to go survey facilities. We're going to collect data, and I'm going to implement systems. So that's exactly what we did. We collected good data, and I implemented almost every CMMS out there for a couple years.
Mm-hmm.
Then I ended up at a very large healthcare system in the U.S. here, working there for multiple years on site. And after about 3 years, they said, we need to write our own program. And I said, well, what do you mean? And they wanted to write their own CMMS. And I said, okay. So it was me and three other people. And we sat down in 2006 and we started writing a CMMS in conjunction with this hospital. And the criteria was they didn't get along with their IT department and they wanted me to host it in 2006.
Mm-hmm.
So that's when we got into the CMMS business, and we created the first SaaS, 100% SaaS model in 2006, and created a CMMS with this healthcare institution. They had 17 hospitals throughout the country. And we wrote it with them, listening to them. And then we start selling to outside that organization. And our key there was they wanted to keep it simple. They wanted it to be intuitive. They wanted the information. They realized how important the information was, not only at the manager's level, but at the technician's level. If you can show the technicians how valuable this tool can be for them and how they can use it to benefit their lives, it's a win-win situation. Win-win situation for everybody, because they see the benefit. They're going to put the data in. The managers will get the data they need, run the reports, and be able to manage their facilities.
Yeah.
So that was in 2006. And then, we've been growing the application since then, adding modules and customers. And we're still 100% SaaS company.
That's great. And what I love about the story so far is how your background translates so heavily into it, informs the venture as it relates to designing the software, because not only are you listening to that specific healthcare system, right, where they at first, I'm assuming that their initial problem was, well, we need something that works the way we work. And then you've already been doing that, working with lots of different systems, because you're originally going in and doing the data collection, which to me, I've always referred to as either site commissioning or a combination of site commissioning and asset commissioning, where you're coming into these hospital facilities, these healthcare facilities, and essentially web enabling the building envelope as it relates to the work process. How do we work currently? And can we have a system that matches our process or processes that'll get us there, right? This concept of having an end in mind. So I really love that, because you weren't just saying, I want to build some software. You were saying, well, we've got all this experience. Now we've got a hospital system that's identified a very specific problem, and that we want all this, but we want a system that really matches exactly how we do it. I like that, because the odds of it being a proper workflow are extremely high. And you simply, because there's a difference. I was on a podcast recently. Sorry, I got another question, but I want to just tell this little story. I was on a podcast recently where I was talking to someone that's going to come out later this week. And he was really focused on the first thing you should do. So if you're a healthcare system, for example, the first thing you should do is understand your process, and then find a CMMS that satisfies that when you're looking around. And this is why I was so excited about, kind of getting you on here and talking about FSI, because this is specific for healthcare. That's important, because that means if you're in healthcare, it's very likely to meet your existing process or processes. Whereas with other systems, you got to start changing the way you work. That doesn't go well, because the people that are actually using it, right, frontline workers, they're going to be like, we don't work that way. Exactly. Why would I use it? So crazy. So once.
So when we built the software, listening to the customers, it's easy just to build it for one customer. But because of our experience with all the different applications, we were not going down that rabbit hole. I had a great team behind me that we could decipher, okay, let's listen to what the problem is. let's provide them a solution, see if it's going to be acceptable for them, but as well as any other hospital. So, we built an application. It's called CMS is the application. It's originally stood for Custom Maintenance Software, and
Hmm.
it was also a cheat on CMMS. It was an easy 3 letters to remember there. But we made it flexible enough that, it could meet the need of a very large hospital or small hospital, because you can configure the screens and add and delete certain fields there. Because we like you said, we didn't want to make that one product that fit the one hospital. We wanted to make something flexible that, a 10-bed community hospital could run, or a 2,000-bed hospital could run at the same time.
Yeah, I think it's great because you're doubling down on the actual problem, and then you're relating that problem across different sizes and kind of, you know, uh, workloads, if you will, when it comes to the varying hospital systems. And the fact that you work with so many of them really, it makes the solution itself bona fide, well proven. You're getting tons and tons of feedback, and I know tons isn't a quantifiable number unless you're talking about 2,000 pounds, right? But my point is, you're getting so much feedback from users to further inform how you work, how this, how that all communicate together, and I think that's great. Now, once built and launched, so you're going through these years, you're getting more and more clients, getting more and more feedback from those clients, and this leads to kind of now. I want to talk about like current trends that you're seeing as it relates to healthcare CMMS, or even CMMS in general, that you would find are concerning. Uh, what concerns you? What are you worried about as far as trends that are happening right now, whether it's with the customers, the systems, the providers, any of that?
Yeah, the current trends that we're seeing in healthcare, I think, is across the platform. What we're seeing is a retiring workforce in the maintenance field with a lot of knowledge walking out the door. So a lot of our clients are having this issue of how do they replace that knowledge? How do they get that knowledge out of that person's head before he retires? And how do we train the new person? So we've been working with our clients here over the past few years and developing tools and processes to get that information. It could be as simple as interviews, with a technician, um, providing some of his time before he leaves. And maintenance isn't glorious. I mean, it comes down to, where's this shut off valve for the third floor? You know what I mean?
Mm.
And a lot of people don't realize that, but that's valuable knowledge when we have an emergency. So we're working with clients to gather this information and put it in the CMMS. I mean, it's a perfect place for it. So you can store a lot of data in there, but you have to make the data easy to get to for the new guys. The new generation, they grew up on iPhones and video games, and so you have to make it easy for them to get the information. So what we've done is we've incorporated different graphical tools. Where our one product is called CMS View, we're placing work orders and assets on floor plans. Here again, what it does, it cuts down the time for that new person coming in to find this VAV box in the ceiling. He knows exactly where it is. So what we're doing is we're working with clients on that aspect to cut down training for these new guys to be able to find it. And then when they find the asset, where we could pull up a video and show them how to PM that unit. And any notes from the retiree that we had in there, whether they're pictures, notes, certain, unique things about this asset and what you should look at, before maintaining that. So getting that information out of the head of the retiree and putting it in a format where the new guy can find it easily. And we even incorporated some virtual reality where we do some 3D photos of mechanical rooms.
Mm-hmm.
And then we can click on the asset on the air handler, and it'll take you right to that air handler. So it's more of a visual. Because some of these new maintenance guys, they're not sure what a condensate pump looks like. But if they can see it in the virtual world and see a dot on it and click on it, it's part of the training as well. So they
Right.
know, okay, this is what a condensate pump is. It relates there. It's all part of this training of the new guys. So going back to your trends, it's the retiring workforce. How do we get that knowledge and how do we train the new people? So
Yeah, and it's just to kind of confirm that with us as well as, for anybody that listens or watches, that's a big deal right now when it comes to like the skills trades. There's a big gap. There's a lot of people retiring. It seems that there might be less interest in people moving into these fields that are absolutely critical to what we do every day. So I think having that tribal knowledge, if you will, available through a platform that really not only collects but essentially makes meaningful the data that you have is a way to empower those new technicians and whatnot coming in at all different levels of the organization to see, well, what's been going on here. It's almost like, here's the dossier, but you don't have to flip through a bunch of pages. You can go through now on the system and start to see and understand where things are. How do you get there? Where's this lever versus that lever, and on like that. And that's the way it should be. One of the things one of my former business partners used to do is whenever somebody would come into a new role and start to own that role, at some point start to build what you do on a daily basis into some weekly drops, some videos, things that you type up so that it's there and you curate that knowledge. So that's a really good thing. So now I want to switch that to what is a current trend in 2023-ish that you think is a good thing, something that's like starting to happen that we see as a good thing for the industry when it comes to CMMS in healthcare or healthcare in general.
yeah, what we're seeing on healthcare, and we're a little behind, is the standardization.
Mm,
Um, you know, Anytime you implemented a CMMS, you had to go out there and reinvent the wheel.
mm,
And then every hospital thought they were different, and you treated them unique. But in the back of your mind, it's almost the same. It's a couple little tweaks here.
mm.
But the problem there, when you have, 100 implementations, 100 different ways, you can't compare hospital A to hospital B. So in 2019, there was a group put together to come up with some standardizations. The group was some different hospitals, different organizations, the ASHE, ASHRAE, FIG. We all sat around the table for about 2 to 3 years developing standards and just the nomenclature. How do we call out the geography, the locations, the buildings, the floors? What is a unique format to come up with that? As well as on the asset side, the categorization of assets. We all know, you can call an air handler 5 different things. What should we be calling it? And let's come up with this nomenclature. Because with this standardization, now we can work together. The internet's been a great thing. And the next step is the AI. But without the standardization, AI is not going to work in the hospital maintenance field here.
Yeah.
So in 2021, the ASHE adopted these standards this committee came up with. ASHE is the leading healthcare engineering association. So what we're seeing here in 2023 is this is really starting to um, pick up speed here of everybody using these standards. And I
Mm,
think, with these standards calling the same things, it's going to lead into the next generation. And the next generation is having huge amount of data that we can look at and compare and call it the same thing. Because, like I said, in the old days, and I've been around for a while, it was hard to get that information. It was hard to say, hey, at this hospital, you have 25 employees and you're 1 million square feet. I'm 1 million square feet and I have 50 employees. What's the right number? But I think in the future, with all this good data, if we're calling the equipment the same things and the buildings, identifying the buildings, in healthcare, is it patient spaces? Is it office space? Business occupancy is key. for all these metrics that we want to establish here. And
Yeah.
the standard is the standards. So we can call it the compare hospital to hospital with these standards. So I see that as a trend, and it's something I've worked on for the last 20 years, but it really took place here in the last 3 years, and it's starting to speed up here. So
Yeah, I think and I like that you brought up that specific trend because it falls right in line with what I'm hearing, what I'm seeing, and what I'm thinking. And it all seems to revolve around a combination of the data. So some people would say we have a renewed or a modern day digitalization of what we do happening, as a trend. And that certainly is going to relate to AI. And I think what you said specifically, why AI can't work as well without the standardization, is it will go too many places to interpret said data because it needs to learn, well, why? What is this data? Why is this data? And where do I use it to further improve? So I think that's a great current trend that's happening really everywhere across the globe. And it's very interesting to see what it's really going to do. One of the things that we also talk about on CMMS radio pretty regularly in the last few months is, even with AI, you're not going to eliminate the human element. The human element is a critical component to what we do, especially in a healthcare environment, right? So as that improves, data becomes better, more available. AI learns what to really do with that data and what that standardization really means, because AI needs to understand why as well.
yep.
Now we get everybody moving in a much, much, much better way. And I think the younger generations, this is not about ageism, but it's about the way they view the world through data. Because no matter what, even if it's, LOL, it's data.
Mhm.
It's meaningful to them. So as that gets closer and closer together and the why lines up, it'll be okay. But they still need that tribal knowledge and all that stuff that we were talking about. So we're going to call that the welcomed trend that I had mentioned in my show notes. So now, as far as what you see on the horizon in this space, healthcare CMMS, what do you think is in store other than AI for healthcare CMMS as we're moving into the next couple of years? Anything else?
Yeah, what we're seeing, and it's been around for a while, but the CMMS is the hub of the wheel. And you have to have the integrations to the other systems. You cannot be a standalone like you were 10, 15 years ago. The CMMS, isn't a standalone. It has to be able to talk to these other systems, whether it's a timekeeping system, MRP system, warehouses, purchasing, energy, building automation systems. You need the CMMS to be the hub and pull in relevant information, from these other systems to talk to each other. Why do you need to have all these duplications, these systems? And so I see a simplification on the horizon, with the CMMS being the hub and with these analytics tools, to be able to look at multiple systems and pull out relevant information, about your operation. That's going to help you there. But it's exciting, and AI is there, and like you said, AI is not going to turn the wrenches, but it can help them, make the decisions, and hopefully the predictive, and if you get enough data out there, you start doing predictive maintenance on some of this failures of the equipment.
Yeah, I agree. I agree. So now what I want to do is kind of switch it to how people can reach out, how people can connect, because I think they're going to want to learn about FSI. I think they, might want to talk to you or someone in your organization and just say, hey, here's what we're doing. Are we doing it right? Is there anything you could add value? Anything like that? Or if somebody just wants to have a conversation with you, what's the best way for them to reach out to you?
Yeah, the best way to reach out to me is via email. They can reach out to me. It's J Serwinski, Serwinski, at fsiservices.com, or on LinkedIn. You can find me on LinkedIn. If you look up FSI, you can message me there, and I'll be happy to get back to them.
Good
But
deal.
yeah, I've been in the industry for 35 years and traveled a lot. 20 years on the road there, Monday through Friday. So I've been there, done that. So I have a lot of experience, and I don't mind sharing it.
Well, I appreciate you making this time today. I know we've been working for a long time to make this happen. I think a lot of the information we've discussed as just a general introduction to you and to FSI, I think that's helpful for people. And I myself just like the fact that it's focused, extremely focused and purpose built for healthcare, because if you just try to adapt any system, sure, you can pull it off. But when it's got that kind of information behind it that comes from the people that really have been there even before a CMMS was being used in those environments. I'm not talking about going back to the 60s when CMMS started, but as you mentioned, when you get between '02 and 2006 and you finally got this pure SaaS model for a comprehensive solution that works the right way for healthcare systems, I think that's advantageous to people, because if you're trying to fit a square peg into a round hole, it's going to be tough. And this kind of softens those edges, right? Makes it fit.
Absolutely.
And I really appreciate it. And what we'll probably do, and I'll leave this for everyone, is we might do some follow-ups in the future, because I still want to learn a lot more. But at the same time, we can't sit and just bang away for 2 hours. We all got schedules and all that kind of stuff. That's why I'm so thankful we finally got to do this. And with that, I'll put some information up for people so that they can learn more about FSI. If it's okay, I'll put your email up on the video version so that people could reach out. And with that, I want to really thank you for your time today and for joining CMMS Radio, Joe.
Okay. I appreciate your time. Thank you.
Absolutely. Did you find this episode helpful? Please send us some feedback, suggest a topic, or ask a question. Reach out to CMMS Radio if you need a co-pilot on your CMMS project. Visit cmmsradio.com and use the What's on Your Mind link. Thank you for tuning in to CMMS Radio, your resource for all things CMMS, from selection to implementation, to help you make better choices, learn from industry experts, and have a successful CMMS journey.